So I always found challenging to get my clients to feel that intra-abdominal pressure in their back. For the low back patients, it's oftentimes not very easy thing to do. So this is great tip how to fix that issue. So for this, what you can use is basically a piece of TheraBand. Green, I found green is actually perfect for this. What you're going to do is just wrap it around your back, kind of around that QL area. You're just going to cross it, so it's going to give you almost like all of that back quarter area. You're just going to create a little bit of tension. As you can see, it's going to squeeze my abdomen a little bit, and you're just going to let them breathe against the band. I'm going to show it from the side and from the back. So again, like with all of these drills, the first step is to get that nice expansion 360 degrees around with breathing. The next step is going to be able to hold that expansion while they're breathing out. So how we're going to do it is to cue it. Well, the cue is for everybody is different. Somebody just needs to feel that pressure, don't let it drop. For somebody, it's that little bit of poking, little bit of stimulation. Everybody gets there kind of a little bit different. So, and oftentimes it doesn't just happen like this. So just be patient with this and take your time. So again, like what you can do is just cross it, give it this nice pull, and then again just breathe into it, and then hold that pressure and breathe out. Again, I will just show it from the side. And again, breathe and hold that expansion out. And then again, relax. Usually what I do recommend is to start maybe like with a cycle of 1 breath, then progressing to 3 breaths, 10, and then just holding it, let's say, for 30 seconds, and progressing into more functional positions, so you can go to plank, standing, sitting, whatever suits. That actually brings me to another point. Definitely, if the client is struggling to do this in the, let's say, in the sitting position or in the standing, get them into supine, get them relaxed, support the feet, and just let them really feel this area, and let them experience that feeling first over there. Then you can try to sit them up. For me, oftentimes it happened that in first session, like in the supine, I'm able to get it straight away. They're going to get nice relief from the back pain, even oftentimes without any manual therapy, so just getting that elongation of the back. But then as soon as they sit up, they're not able to perform the pressure. So just that might be actually great thing to give it to them for home exercise, which is kind of like they're able to succeed just a little bit or just go back and forth. And within a week, that connection of their brain to that area is just going to kind of almost like click, and they're able to do it way easier. Then you can, with the sessions, then you can progress it into whatever their position they need it to requires more. So some hinging, some extension, side, some rotational stabilization, whatever they need to. I will maybe just show you the small example of the supine position. So again, just lying on the back, in the supine as neutral, legs are supported, pelvis is neutral, ribs are down in that explorative position. Then I'm just going to cross the band around the abdomen like this. A little bit of tension. You can almost like relax your elbows like this. You can put a little bit of external rotation into it, and then just and again just breathing in and out while holding that pressure, basically that expansion out, while independent of the breathing. Then I just relax, activate, relax, activate. I hope it's a little bit visible on the video. The most important is it shouldn't be just bracing through your rectus abdominis, and definitely it shouldn't be kind of through the back flexion or extension. Guys, hopefully this video was helpful. Again, like it doesn't require much equipment, just some TheraBand. This is something which, at least in my case, almost like every client is struggling a little bit, because So especially for low back patients, they don't have great body awareness around their back. Oftentimes that area is possibly just smudged in the brain or whatever, but so this little bit of tactile cue might give them a little bit more of an idea like what to do, rather than we are like push this, and they're looking at us like, I don't even know what you are talking about, but I'm really trying. So this is just that pull of the band is going to give them that little bit of tactile feedback. Okay, hopefully this was helpful. If it was, please give it a like, subscribe. I'm going to be bringing more tips, tricks like this in the future.